Healthcare is so complex. There's nothing personalized about it. There's nothing about it that's easy. And the nurse navigator makes it easier.
My role as the nurse navigator is to interact with the patients and families. And the nurse navigator is able to move along the continuum of care. They come in to the hospital and we're able to communicate with the team what the patient's needs are from our perspective.
Nurse navigation improves the care of our patients because there's always someone available to them while they're at home to answer questions, manage their symptoms, communicate with their physicians, prevent readmissions, and prevent major complications.
At the very core, a nurse navigator comes alongside the patient and the family to help them in any possible way.
In our case, the navigator was very explicit and able to answer, and if not able, sought out the answers to the questions we had. I think she made a great deal of difference. They present the personal touch or interface with patients.
Navigating is all about connection, and the connection is important so that the healing process can begin even before the surgery takes place. When someone's suffering, in this job, I can make a difference. I can make the connection and be with them from home to hospital, back home again. That's where the joy is, both for the navigator and I think for the patient and the family and friends.
There can be many different ways that I think I impact someone's life. It could be a matter of providing emotional support, education, and really empowering that person to make their decisions with full information. I think what's unique about Hoag's navigation program is there's many different diseases that patients are challenged with just having that continuity of care and having somebody who is that touch point. Hoag has invested in our program because they're really committed to being sure that patients feel cared for, number one, that they have all the resources that they need to support them, not only at their diagnosis, but throughout their survivorship.
That was the big difference, that she was personally involved and able to address questions and get answers where I had no other resource for them.
That's where the healing is. It's in the connection. It's all about connection. And that's what makes Hoag different. Hoag cares about the connection. And it's more than just at the bedside. We're not just any old hospital. We're Hoag. And that's the joy of this job too. I really believe that Hoag believes it's important to support the patient and the family.
The navigators are very vital in the process. And I think that that's something that maybe other hospitals don't have or aren't as well equipped to handle. So I would encourage more navigators, and certainly would encourage navigators in every medical process.
What I love about being here is I get to be of love and service to oncology patients every day. It's consistent with the hospital's mission, and it's consistent with my personal mission. It's not just about the medicine, it's about your care.
We are focused on the patient, their needs, their family's needs.
What sets Hoag's program apart from all the rest is that Hoag values the patient, and they're willing to make the investment in a navigator, someone who can make the personal connection. There aren't any places in Orange County that can provide that kind of personal connection. And it's a great honor to be a part of the team that can provide that for the patient.